Hello again. We're back.
Again.
We're back. Again.
It could be a song.
It should be a song.
I feel like it probably already is. Whoa.
Yeah, something's in my head, but not. I'll stop talking before I sound dumb. So, surgery. Surgery exists. Surgery is a thing. Most animals go through at least one, we hope, for spaying and neutering. But other surgeries happen in life depending on life.
This is a crazy segue because we literally just got done talking about acupuncture and now we're talking about the exact opposite.
My brain's not working
The exact opposite.
Molly, why don't you introduce this?
Hi, my name is Dr. Molly O'Banion and I like surgery. Let me tell you about a day in the life of a surgery technician / surgery doctor, and I'll walk you through what's going to happen when you go spay or neuter your pet, or get its teeth cleaned, or get its spleen taken out, or have a tumor removed. The list goes on and on. Yep. Step one. So we're going to talk about the before, the during, and the after. So, and I'm typing my list so that I can stay on track. You're welcome.
We're having an ADD flare up today. Acupuncture for that. Or surgery.
Okay, so it's called a brainectomy. So before surgery, you have scheduled your dog's spay.
Okay.
Floof.
Floof is back.
Floof is getting spayed finally. You've scheduled Floof's spay. Floof's spay is tomorrow. What do we do?
As receptionists, I tell people to fast and drop off in the morning the next day.
Fast at least, dog and cat, fast at least 8 to 12 hours. At least. We need to make sure their stomach is empty, because if their stomach is not empty, a lot of times the drugs that we use can cause them to become nauseous. And if they don't have good control over their airway because they're under heavy medications and they vomit, then they can aspirate, which means inhale the vomit, and then you have pneumonia, which is really fun.
Yeah.
It's not.
What's the difference between the 8 to 12 hours? Is it like size of animal, what the procedure is?
If you give people a zone, they'll fall somewhere in the middle.
Oh, okay. Just mental games.
Yeah.
I didn't know if it was like this is a really quick, easy neuter, so you only fast for 8 hours versus like a splenectomy, which you should do.
Really, we tell, like, my staff is trained to say don't feed after dinner.
Yeah, 8 p.m.
Right, which would get you right at 12 hours, but then we always, they're going to give them a snack because Floof looks at them sad-like, and
and also because we get this question a lot, we say no food after 8 p.m. the night before, but if we're on chronic medications for something or the other, and you have to give it a pill like every morning and it won't take its pill without like it being wrapped in cheese or some peanut butter, that's fine. Because it's this much food versus like a full stomach meal.
Yeah, it's like a snack.
It's not.
A tiny snack's okay, but don't make me chase you because you fed it dinner the morning of, or I don't know. You know what I mean? So what about water?
Water, we say water is fine until about 6 a.m., which is when they usually head our way to drop off. We drop off between 7 and 8 a.m. So it's usually good probably 2 hours before, I would guess.
Yeah, it's fine. I mean, in people, they don't let you drink water for a long time before, but in pets, give them water. It's not a big deal. They'll be fine.
Yeah.
I'm not going to fight you over a bowl of water for your animal. And if I'm worried about them aspirating, I'm worried about them aspirating like food material, not so much water.
Yeah.
Okay, so we're fasting. We're pulling water after 6 a.m. We're putting the dog in the car. Floof. We're putting Floof in the car.
Floof. Make
sure you buckle up. It's important. Click it or ticket. And then we're driving to the clinic and we're dropping Floof off in the morning. Why, if Floof's surgery is at 11 o'clock, why do I have to be there at 7?
We have paperwork that we go over.
Sign on the dotted line.
Sign on the
Sign
dotted
on
line.
the dotted line.
There's there's consent, understanding, additional services if you want them. For us, it's like microchipping or the red light laser therapy post surgery. And then once Floof is dropped off and gets to the back, we do a intake exam, check all the vitals, make sure those are good. If they are requested by the owner or required by the clinic, if they're over 7 with us, we do preoperative blood work, check kidney and liver function, make sure everything's good to go under anesthesia, along with like blood clotting. EKG, we can check, see if there's any underlying heart issues. I feel like if I had to guess, that takes our surgery technicians maybe about 15 to 20 minutes to get done and submitted, and then an additional 20 to 30 minutes to get the results. So it's probably about a 45-minute process to get all of the pre-diagnostics necessary before we do anything gathered and you or another doctor reviews to see how to adjust anesthesia or whatever, or make sure it's even safe to do the surgery.
That's assuming that everything goes as planned and they're not being pulled in another, 5 directions at the same time.
Oh yeah.
Or the dog is not, like, if Floof is having a bad day and Floof is trying to bite us, then that slows down the process even more.
Yeah. And a buffer time of the, if we're expecting, if Floof is easygoing and intake is easy, but then Floofette and Floofaroonie come in for emergency services.
I love Floofaroonie. Don't give him an emergency.
Okay, Floofaroonie's fine, but Floofarette is...
Floofaroonie has the pink titties, and his blood's already in the machine, and we have to wait our turn.
Yeah. Little things like that slow us down. And then, once they do get all the results, and the doctor has the time to review everything, then they give preoperative anesthetic injections, which is almost like an anti-anxiety, just kind of helps us chill out, get ready.
Depends on which ones we're using. Yeah. But yes, it's like a sedative.
Yeah.
Kind of.
Yeah. And then y'all give what's the other one? Is it the Rimadyl injection y'all give early too?
Sometimes. Okay. Depends.
Okay.
So some sort of pain, some sort of sedation, some sort of dissociative, so they're seeing green fairies and not worried about life.
Oh, that sounds awesome.
Love green fairies.
Love green fairies. You were a green fairy. No, a pink fairy. Last week.
It was purple.
Pink and purple are very close.
She says she went to school for coloring, but no.
I edited your family picture.
So assuming everything is good to go and Floof is going to go forward with her spay, then we have to go to the next set of steps. So we've done blood work, we've done EKG, we've signed all the paperwork, we've given Floof the sedatives and the dissociative drugs. We've let those sit for at least 20 to 30 minutes for them to actually kick in. We've placed the IV catheter, so if case Floof has an emergency, we can give life-saving drugs really quickly instead of having to fight getting access.
Yeah.
Let's say all of those things are done. And it's Floof's turn. Now what?
Now the surgery tech gets us onto the table.
Whoa, calm down.
No? To get intubated?
Calm down. If it's something as easy as a spay, then yes, the technicians know which packs to use, which means a pack is like a
pre-packed
suitcase. Sterile toolkit.
Yeah.
Suitcase.
It's a suitcase.
It's not a suitcase.
Tools.
There's no zippers.
No, there's no zippers.
All suitcases have zippers.
It's a swaddled basket of tools.
Swaddled. It's kind of nice.
They're real snug.
Kind of like that.
And then we put them in the autoclave to get cooked.
So all of our swaddled kits have different things in them. And so they have to choose the right swaddled kit for the right job.
What are the ones I know? Because obviously I can see spays and neuters spays for different sized dogs. I know y'all have, and then neuters. Do you have to do different sizes?
There's like a cat neuter and a dog neuter.
Okay, and then what other ones do you usually have prepackaged?
There's an eye kit.
That makes sense. Okay.
There's a couple different bone kits.
Okay.
There's a couple different there's a large animal kit. There's like we call them the large spay packs, but they have like lots of extra clamps for things like splenectomies and things we expect to bleed a lot.
Oh, okay.
And then there's like special individual wrap tools that aren't in a kit. They're just wrapped by themselves.
Little plastic see-through.
Yeah. So like if I need my Lone Star retractor for a Tikaboo, I just say I need the Lone Star retractor, and they pull the Lone Star retractor out without having to unswaddle. And then they just open and hand me the thing. And then they have to know, is this a procedure that we're using cautery? Is this a procedure that we're using suction? Is this a procedure that we're using the bone saw? Like all of these things, they have to get prepared, because if I have this animal on the table, every minute under anesthesia counts.
Yeah.
Right? Every minute under anesthesia is another minute that we're putting that animal's life at risk. So we like to have everything ready before.
Okay.
So if I'm doing a procedure they're not familiar with, they come and ask me, what do you need? And I tell them so that they can get it all.
Oh, yeah. I've heard them say they do that.
Mm-hmm.
But our two surgery technicians, they're freaking awesome.
Yeah, they've worked with me long enough. They know. And at this point, they come in there and they go, what do you need? No, don't tell me. You need this, this, this. And I go, mm-hmm. And then I go, can I have suction too? And they go, ugh.
They treat you like that. So, but yes, a shout out to Star and Gabby. I've thought about asking them to be on the podcast.
Oh, man.
Gabby will not. I already know it. Star might. I know Gabby would not.
Star, catch her on a good day, man. She'd be ranting.
I love Star.
She'd be ranting about her ducks.
She's so fun.
Is
she a fire?
Australian accent would come out. No, she is not. She is. I don't fucking know what she is. She's
developing.
She's still finding herself. That's fine. We love Star.
I mean, Gabby's like everyone's mom. She's so calm and collected.
Gabby is an Earth 100%. 100% an Earth. Google Earth.
No, more details, please. Google acupuncture Earth element. Better.
Hey, goo. Earth.
Hey, goo.
It'll pull up a picture of Gabby. I'm just kidding.
That would be awesome.
Because it is her to a T.
Google's behind this wall. Hey, Google. Play Twinkle Twinkle Little Star. I can't. We figured out where the music's coming from. I don't even know how to explain. Okay, so whenever
Google's in the wall.
We haven't filmed in this room before. And so
that was crazy.
We've been hearing this really like calming music, and there's I didn't know if it was a sound machine sitting in the corner like over there. I was like, is it this? I plugged it, it's not. It must be coming from the lobby, which is on the other side of this door wall. We were like, okay, well, we'll just ignore it. And then just now saying, hey Google, we discovered the receiver is like right here. I really hope it caught everything, but you probably didn't hear it. I can probably turn it up. I'll do my best.
That's very sad.
That was
excellent.
So satisfying.
It was excellent. That was excellent.
And this is our lives pretty much regularly. The chaos.
Totally forgot what we were talking about.
Google.
We're talking about Google.
Surgery, Gabby.
Gabby is Earth. God. I'm not going to do it again, but just trust process. Gabby is Earth.
Gabby's going to be so mad we talked about her this much. Anyway, so surgery.
She likes earrings.
She does like earrings.
Send her an earring.
Goofy ones.
Yes. Oh, I got her silly ducks. No, silly gooses.
Silly gooses. You also you got her the little. They were really cool. They were like the fish in the bag.
Yeah, I got her fish in bags.
It's like little like when you go to a pet store and it's like you got the bag that's clear and it's got one fish in it, it's that. And their little earrings are so cute.
And then during hurricane season, every year we lose power every year, all the time. It's so annoying. So I got her flashlights that work.
In earring form.
You know what she does? During surgery preps, like when she's putting in trach tubes, if she's wearing those earrings, sometimes like somebody's holding the mouth open, right? And she's trying to put a tube down their windpipe so that they can breathe. She'll use her ear. She'll shine the light down their mouth so she can.
That's amazing.
It's excellent.
She's like
best gift I've ever given anybody.
Anyway, we love Gabby. So Gabby and Star can read Molly's mind. Our other doctors do surgery as well. Molly's just always in there. She loves getting her surgery days. We can load her up and she never has to see an appointment. Molly's in her happy place.
I'm also the worst at communicating of all of them, so they have to kind of read my mind. They don't have a choice.
Yeah, that's true.
Because they ask me what I want, and I just look at them like I have no idea what you're talking about.
For what? Lunch?
Yeah. Oh, no, you tell me. It's bad. So they get the packs ready. They get the suction ready. They get everything. I can't.
Every time.
I can't. I do it during procedures too. I can't. Like, I'll forget the word suction and they'll go, "What are you looking for?" And I go, and they hand me the thing.
Stupid. It's okay. You were putting all of your IQs in your fingers. We're losing control quickly.
Sponsor us.
You associated with us.
This is the last one. We cooked up.
This is the last one. 3 is our limit. Packs are ready.
Packs are ready. They're laid out. The equipment we need is ready. It's laid out. Now we can get the dog.
Now we get the dog.
Floof. Floof.
Floof.
Come here, Floof. Here, Floofy, Floofy, Floofy.
That's not how it works. They actually go physically get the dog.
Yeah.
Because sometimes they're chilling.
It's in a kennel and they don't have thumbs, so it makes it hard. So you get Floof, you bring him into surgery. He's getting spayed. It's a she. You bring her into surgery. You have to now induce the anesthesia, which is a different kind of drug. And there's a couple different ones. But you induce the anesthesia, usually inside their IV catheter. And when they're asleep, you have a couple of minutes. It's fast. I
always wondered this.
You have a short time frame. Well, really, it's like, it depends on the drug, but it's not very long. So you have a short time frame to get them intubated and on the gas to stay asleep before they wake up and they go, "Wah!"
Gotcha.
It's like zombies. This can be scary. So when we're intubating them, that's when Gabby uses her flashlights. Somebody holds the mouth open and somebody looks down the back of their mouth. Back here.
I thought you were about to ask you to demonstrate. Okay, cool.
No, it's me demonstrating, and you love it when I do this. So back here is your larynx. Back there. And if somebody sticks their tongue out, which when we do it, we hold the head open and we pull the tongue out, and you look past the tongue, you can see this like valvey thing right here. And the valvey thing is your laryngeal folds, and they open and close when you take breaths. That's why whenever you're eating and drinking, things don't go in your lungs.
Yeah.
Because they'll close and then they'll open.
And that's why you don't talk while you chew.
And when you mess up, there's consequences.
I've learned that 5 times in my life.
So when they take a breath and the folds open, you have to go with the tube and get it in there.
Interesting.
Not that fast or you'll tear it, but it's like a game.
Yeah. And is are you aiming for the top or the bottom?
Just like in it.
Just in it.
Intra flap. You know who's really good at closing their flaps? Cats.
That doesn't surprise me that they'd be difficult.
God, they suck.
Even when they're asleep.
I literally use a guide tube. So my trach tube, I have it, and then I have like a little thing inside the trach tube, and when they open, I go with the little one, and then that kind of keeps it open so that I can like push my tube in.
Gotcha.
Or I will spray lidocaine down their throat so the flaps stop moving. If they really piss me off.
I may do that to my cats just because.
I should. They're asleep. They don't know. But come on. Stop. Open your flap. let's move forward. So when we have our tube in, then we hook it up to the machine and we can run oxygen and we can run gases and stuff like that through to keep them asleep and to keep them oxygenated.
Yeah.
We then hook them up onto all of the monitoring equipment.
Yes.
Which we could have a whole ass conversation about monitoring equipment because there's a bunch of different kinds and it really depends on the type of procedure we're doing.
Yeah, I was going to say, y'all have more hookups on the bigger ones.
Mm-hmm.
You got the beep, beep, beep. You got that one.
I hate the beep.
The beep is very annoying.
It rattles my bones.
What is that one monitoring? The blood pressure?
It's heart rate.
Heart rate.
Beep, beep, beep.
No, it's not that one. It's the other beep. Isn't there one that goes like beep, beep, beep? Beep, beep, beep.
I don't freaking know. That sounds cool.
I don't know what all the things do.
Me either.
And they have to check them every 5 minutes?
We have to write them down every 5 minutes, but we're looking at them all the time. And like the tech is staring at them. I glance over at them very frequently during the procedure. Like it's a constant.
Yeah.
We're constantly watching the beeps.
Yeah.
Because if those numbers start dropping or if those numbers start increasing, it tells you about the level of anesthesia the pet's under. It tells you about how their systems are handling the drugs. It tells you whether they're feeling the pain that you're causing. And so we can add more pain meds or we can put them into deeper. Like it gives you a lot of information.
Oh, okay.
So we watch really closely. We write it all down so that we have a record of what happened.
Mm-hmm.
We then have to sterilize.
Mm-hmm. Start to the shave.
Always. Shave, scrub. The scrub has to sit there for a certain amount of time to kill all the bacteria. While the techs are shaving and scrubbing, I'm scrubbing. Yep. And I'm gowning and I'm gloving. I'm getting myself sterile to be able to dive inside of you. Mm-hmm. Floof. Because I can't put my bacteria-ridden hands inside of floof. That's rude.
Yeah, and y'all probably all know this because we all watch those medical drama shows.
That's fantastic.
Getting all the stuff up, especially when it's like a splenectomy or something like deep, and she's like doing like head to toe. I don't know what are there different levels of sterile dress? Yes. Okay.
So there's different levels of sterile procedure. So there's like sterile, there's clean contaminated, and there's contaminated.
Yeah. I would say what's the one? I know when you do the splenectomies, and I think also when you do bone surgeries, people don't need to come in and out of surgery to ask questions. You find someone else or you wait.
Right. Bones, intra-abdominal and intrathoracic, which really intrathoracic and bones are like...
Lock the door, duct tape it.
Yeah. Intra-abdominal isn't as particular, but it's sterile. Yeah. It's the dental procedures and the eyes and the wounds and the ears and that kind of stuff that's like your clean contaminated. Well, not dental, so that's nasty. But like that can be clean contaminated because it's exterior.
Gotcha.
And then contaminated is like colonic polyp. Real yucky.
Gotcha.
No way to make that a sterile environment. No way.
No way, Jose.
No way.
So that's why a lot of times the dentals end up in the afternoon. If we get
because we do the sterile stuff first. We also want to watch them wake up longer. Like a dental's routine.
Yeah.
Crazy. Chaos. Everybody's talking to us. So okay, so now I'm sterile and the pet's sterile. Mm-hmm. Now we cut. We say cutting. When we cut. And then they write the time down of the cut. And then I perform the procedure.
Do you use the same blade when you cut the outer layer of skin and then the inner layer of skin? Or are there two different blades for each?
Am I going inside an abdomen?
Yeah, we're spaying.
We're spaying floof, that's right. So I use a blade for the skin, the epidermis and the dermis. And then I use scissors.
Okay.
for the abdominal musculature that coats the abdominal wall.
Gotcha.
Creates the abdominal wall.
One cut. One snip, snip.
It's one cut, and then I kind of move the fat away, and then I tent the abdominal wall up, and I make like a little hole with the blade.
Oh.
So that I don't poke anything that's inside. And then I stick my scissors in and cut. Because if you have a blade and you're just cutting, the spleen likes to get in the way. And then if you cut the spleen, it goes like this.
That's sepsis?
That's blood everywhere.
Blood. Yep. I don't know anything.
And you need to keep that. It's good for you.
You do not want to remove the spleen.
No, you can remove a spleen. You don't want to remove all your blood.
Or your pancreas. That's the one that I mess up.
God, she's pretty.
Thank you. I showered. I did my makeup because I knew I was going to be on camera.
I do not.
Well, you're looking naturally more pretty than I am these days.
Skincare does wonders. I don't freaking know.
Sorry.
So
Floof is getting spayed.
Floof is getting spayed. So I do the procedure, and I do it as reasonably swift as I can within margins of safety.
Mm-hmm.
Realistically, a spay, and people think like it's an abdominal procedure. In all of the people movies, big surgeries take 12 hours, and they're like, "Oh my gosh, Floof's going to be under anesthesia for the whole day."
Yeah.
What? A spay takes me 10 minutes.
Yeah.
Unless they're like pregnant or in heat.
Yeah. Or pyo.
Or a pyo. Yeah. A neuter takes me like 5 to 7 minutes. Like it's not like once I open, it's like 10 minutes start to close. So it takes longer to put them under anesthesia than it does for me to actually do this procedure.
Yeah, and the wake up. Because the wake up, I think whenever they get back in their kennel and we're watching them to ready to pick up and they're like actually like on their feet again, the room isn't spinning. For some cats, the room spins for a little bit longer. But I mean, what do we, minimum 4 hours, I think Gabby has said to me before. And that's for like the simple ones.
Yeah, because the most dangerous parts of a procedure are the intubation and the extubation. So the moment when you induce anesthesia and you're putting the tube in their mouth, you can close airway, or they can have an reaction to the drug and they can go into cardiac arrest.
Mm-hmm.
When you're done with the procedure and they're waking up, if you remove the tube too soon and they don't have control of their airway, if you remove it too late and they chew it off and inhale it.
Oh God.
Sometimes during extubation, they get a vagal stimulation, which is like they go into like a sympathetic, think of it as like a stressed induced heart attack. So extubation after the procedure, when everybody's like, oh, the surgery's done, they're fine. Things can happen. So we like to extubate, watch them closely, and then we monitor them for a couple hours afterwards to make sure that they wake up as they're supposed to.
Gotcha. And then we get to go home.
And then we get to go home. So what to expect after? You're going to take Floof home and she's going to go to the dog park tomorrow.
No. No, minimum for the simpler things, 14. Well, I guess majority of the things, 14 days. Unless it's like a bone thing, then it's like bone or tendon thing, it's like 6 to 8 weeks. And that's a whole different monster, I feel like.
Realistically, a neuter, like a normal dog neuter, it's 3 days and then they're fine. They act like nothing happened the next day. But if you let them run amok, then they get like scrotal hematomas and stuff. You don't want to deal with that. So like 3 to 5 days, just keep them chill and then they're good to go. A spay, 5 to 7, because we don't want their bellies to open up. That bad, not fun. Nobody got time for that.
Yeah.
But the things that involve bones, the things that involve chests, the things that involve major organ taker-outers, those take longer.
Yeah.
And so talk to your doctor.
Yeah.
Talk to your doctor about expectations, but it's not usually as bad as people expect.
Yeah.
For the most part.
We typically send home carprofen and gabapentin. Carprofen, I always say to my clients, think like ibuprofen. It's the pain anti-inflammatory, and gabapentin, which is also a human drug, is a neurological pain blocker. But a lot of times we use it because it has slight sedative effects, and so it kind of keeps them just couch potato-y enough to where they're not going to want to have the zoomies.
Couch potato-y adjective.
But like I think I've said in other podcasts, that's not always accurate, because some of our clients, Silas, the Frenchie, I think he took gabapentin and started running into walls.
Yeah, some of them it can have an excitatory effect.
Yeah. So, but I mean, it's rare.
It is rare.
Yeah.
It's not the...
Silas is just a little special guy.
Yeah, and if your pet's one of those excitatory effect ones, there's other drugs.
Yeah.
We just don't reach for them first, but there's other options.
Yeah. Whenever I got my dog spayed, she's hyperactive. I had
no way
carprofen, gabapentin, trazodone, and ACE, because she was also a stray and still getting used to our house. I think that was everything I gave her. And she was twice baked potato.
Twice baked.
Not even a couch potato. She was twice baked.
With butter.
Oh, a warning, because this apparently did happen to my dog. My husband told me. Thank God it wasn't me that was in charge. But after anesthesia can sometimes make the stomach a little wonky. The night that we go home, you do a small portion of dinner. Luke's going to be fine. We're not starving. They can go 24 hours without any food whatsoever. But we still can make like a small snack available to them. And then the next morning, you're back to your normal routine. But also, anesthesia can make the GI system a little gassy. And apparently that within 24 hours, my dog's first bowel movement was kind of explosive diarrhea in the backyard. And then she was fine. But that's also something that can happen, is it makes her system a little bit more
sensitive.
Surprising. Yeah, sensitive.
Surprising.
But you also, I don't feel like we run into this issue very much, but just like humans, it is important that we have a bowel movement within 48 hours.
No, don't freak out about that.
Oh, okay.
Because they're like morphines and morphine derivatives, which are a lot of the pain meds that we use, they slow the GI tract down.
Oh, okay.
So if, we get calls all the time where they're like, my pet had surgery 2 days ago and it still hasn't had a bowel movement. And I'm like, it'll be fine.
Give it another 24 hours.
Is it eating? Is it peeing? I good. Chill.
Okay, cool.
If it's been like a week, that's a problem.
Yeah. And then
e-collars.
God, e-collars.
Bane of our existence.
Hard or soft surgery suits. Honestly, I like the idea of I like the idea of the surgery suits. I like the idea of the soft e-collars. I have never had, I think some of our clients can have success, but the risk that's ran with those, and especially if you have like my dog she's smart, but she's got that puppydom. I wouldn't trust her in a surgery suit or a soft collar. Like, I'm sorry, your life is going to be miserable for 14 days, but you're too stupid.
Oh, whoop, there it is.
Mic drop.
I just, soapbox incoming. It is the actual worst when you put all of this effort into creating this safe environment for the surgery to save this dog's life or to improve their quality of life. And then you get a phone call about, my dog so-and-so didn't do well after his procedure and it's your fault.
Yeah.
Well, okay. It's not necessarily our fault. Soapbox. A lot of the healing process happens when you're at home. And is it your fault? Is that what I'm saying? No. But animals are animals. Mm-hmm. And animals don't understand that they just got spayed. They just know, wow, my belly hurts. Let me lick it.
Yeah.
And then they lick it into a wound that's bigger or an infection. Mm-hmm. And it's not only our jobs. It's not only our jobs to take care of that.
Still on.
It's our jobs to take care of it, and it's the owner's jobs to take care of it at home.
Mm-hmm.
Teamwork.
And we're understanding of the like I make sure that all my clients know, because this is how my cats were. If your pet is too stressed out to eat with an e-collar on, take it off. Usually they're so focused on eating that they're going to do that. And then as soon as they're done, put it back on.
Mm-hmm.
It doesn't have to be one or the other.
Mm-hmm. And if you're sitting on the couch just hanging out and you want them to hang out with you,
as long as you can do this. No. This side. No lick.
You just have to babysit them. And then when you're not wanting to babysit them, put the collar back on.
Mm-hmm.
And save your dog from a second surgery.
And if you think your dog or cat will be stressed, like that's what the gabapentin does. That's why I got the trazodone, because she was going to be freaking out with it. That dog did not care what was going on. She had little pink fairies sitting on her e-collar for 14 days.
I love a good pink fairy.
Right?
It's the best. So,
yeah. And then a lot of sutures get buried with, Floof's got buried for her spay. Some growth removals can be buried, but not always.
Growth removals are harder to bury.
Yeah.
Because the skin is different.
Yeah.
And a lot of times there's more tension because you've removed a lot of skin.
Yeah.
It's a bigger beast.
Yeah. But if you do have sutures or staples, you come back in 14 days to either have them removed or we check on them. For some reason, every now and then they need just a little bit extra time.
Mm-hmm.
And then you're done.
Mm-hmm.
Yeah. Come back if you need us.
Don't come back. You won't need us. It's going to be great. Easy peasy, lemon squeezy.
I love lemons.
Yes. It's the best.
So, yeah, that's what you should expect for surgery. I mean, and obviously this is not to discount feelings. I've worked at Molly's clinic for 5-6 years now. 6 years? I think 6 years. And even I was feeling the stressies of my dog going under anesthesia. And I still need to get my cat's dang dentals done. But I just assume they're going to die all the time.
It is a stressful event. It is not fun. And, even us as doctors, and we do it literally every day, a lot of us won't cut our own animals because it's hard. Like there's an emotional attachment that gets in the way of your brain. And actually, most of the time when I have an employee whose animal is there for a procedure, the employee's not allowed in the room while we're doing the procedure.
I do like that one.
Because I don't need your emotions getting in the way of me doing my job. Trust the system. You're a client right now. Go ahead. Bye-bye.
Go do your job.
Good. Get out.
Get out. Take a long lunch. Don't do that.
It's okay. It's okay.
Yeah.
Anesthesia used to be a really, really scary thing, but we have it pretty well figured out. And we yes, we lose one every once in a while, but usually the vast majority of the time, it's something that's super, super sick. And the owners know that it's a high risk, but it's either we do this or it's going to die.
Yeah, it's kind of a Hail Mary situation.
Yeah. Yeah. I mean, the amount of time in my career that I've lost a normal, healthy pet is like less than 5.
I'd agree with that.
Less than 5. And I've been here almost 10 years. So that's not, and I'm putting things under 8. We put 7 things under today.
Did you really?
Yeah. In this one location. So the odds are in your favor. Don't worry.
Yeah. We should do a separate one on exotic.
Oh yeah.
Surgery and stuff.
Exotics those stats are a little bit higher, but exotics are they're more fragile.
Yeah.
They're more fragile. And they're everything's different about them.
Yeah.
Everything's different about them. I hate buying houses. Don't ever buy a house. Their pre-op stuff is different. Some of them you don't fast. Don't fast them. It will kill them.
Yeah.
Their intubation stuff is different. If you intubate a rabbit, they have such strong vagal reflexes that sometimes just intubating them, just them feeling the tube down their throat is enough to kill them.
Oh my gosh.
It's crazy. So they actually make these special little intubation tubes that are for rabbits that don't go all the way down. They just kind of hold the flap open.
Huh.
I hate them.
I would too. That sounds way too stressful.
Not rabbits. I hate the V gels. I've tried to use them, but they have nothing to anchor to. They just wiggle around like this.
Ugh.
Well.
I want nothing wiggling around.
In the back of your throat.
We'll cut that part.
God damn it.
We hope we brought you some kind of comfort in this episode.
It's gonna be okay. Stop crying. You're pregnant.
I'm not crying now.
You're pregnant.
That's my face. I think it's a yawn. I'm not crying. What am I even crying about right now? Honestly, I'm thinking about... Hey, Google, give us a send-off song.
By the Singing Walrus? The Goodbye Song by the Singing Walrus? Is that a fat joke, Google? That was rude. Can we look this up?
The scale's on the other side of this wall. There's no...
Where is the Google?
Oh, right behind the couch.
It's in this room.
See you next time.
Goodbye.